Welcome to We Are Old, Get Over It, the podcast where we celebrate the wisdom of age and maybe a little grumbling too. Hello, everyone. Welcome to the show. Today, we're tackling a topic that is far too often dismissed as a normal part of getting old. But it is, in fact, one of the most serious threats to the health and independence and confidence of older adults. And if you don't know what it is by now, it's falls. The numbers are jarring. Falls are the number one cause of injury and injury-related death for adults over 65. But there is a critical message we want you to hear today. Falls are preventable, the evidence is clear, and the right interventions can significantly reduce your risks. Joining me today is Dr. Jo Bergh. I can say I'm going to let you tell them what the letters mean, okay?
Sure.
So Dr. Bergh, I usually like to read a quote first, and I just want to read a quick quote, and then I'm going to turn it over to you. I'm going to introduce you, and you can give us a little bit of information about yourself. Okay. The quote is, "Loss of independence results from falling injuries is the biggest issue with many of our older adults." And this is by Catherine Brenda, Geriatric Fracture Program at Cedars-Sinai. You know that hospital, don't you? Okay.
Yes.
And then another one is, when someone falls, bad things happen. And a lady called Mary Tanetta is the one that wrote that. So with that bit of information and warning, I'm going to turn it over to you. So would you please tell us your name again? Even I actually pronounced your name correctly today, which I usually screw up for everybody. But anyway, tell us a little bit about yourself and tell us about what the things behind your name mean. And then I'm going to ask you a couple of questions, and then I'm going to let you go. Okay? So go ahead.
Sounds
Doctor.
good. Thank you, Ken. Thank you for having me here as part of your podcast. I'm excited to talk about falls today. As you mentioned, my name is Jo Bergh, and I am a doctor of physical therapy. So that's some of the letters after my name. The other letters, GCS, just mean that I'm a board-certified geriatric clinical specialist, which basically means that the primary patient population I work with is geriatric, which we define as over the age of 65. So when I'm in the clinic treating patients, those are the patients that I'm working with, mostly on impaired gait, balance impairments, falls. I do also have a sort of secondary specialty in neurological disorders, more specifically vestibular and ocular disorders that also cause balance issues, such as this. I work at UCSF. I've been at UCSF faculty in the doctor's program since 2022. I'm actually an alum of the program. So I graduated a few years ago, worked elsewhere, and then ended up finding my way back to UCSF. That was just an institution I'm very proud to be a part of.
Okay, great. All right. So you're an expert, is what you're telling me. All that means you're an expert.
Your words.
Okay. And if people don't know, UC is University of California, and SF means it's San Francisco, because there are universities of California all over the place, right?
Yes. Yeah. There's quite a few locations.
Okay. All right. So thank you for joining us, and let's talk with the facts, or let's start with the facts. Falls are often dismissed as a normal part of getting old, but the statistics tell a very serious story. Could you help us set the stage? For example, falls are the number one cause of injury and injury-related death for adults over 65. The fact that 1 in 4 older adults falls each year. What's the message that we should give seniors and people that care for seniors?
I think you kind of touched on an important point. People think falling as we get older is normal. I think normal is often mistaken with the word common. It happens a lot, but it's not normal. It's not something that it should happen or is expected to happen just purely by getting older. So I always like to make that distinction of, we kind of write off a lot of things that change with our bodies as we get older as a normal part of aging, and falls is just not one of them. You already mentioned some important numbers, but it's also important to mention that falls can lead to 36,000 deaths in a year, 3 million emergency department visits in a year, 1 million hospital admissions in a year. So that can also result in more than $50 billion in medical costs every year. So it's important that we talk about this and learn what we can do to prevent them. I'll also say that 10% of older adults fall twice a year. So all of those numbers that we mentioned before, one fall in a year, but 10% of adults can actually have 2 falls in a year. And as we know, falls can cause physical injury, but can also take a toll on mental health, social aspects of life, limit independence and confidence with activities of daily living, social interaction, leaving your home. And about 25% of older adults actually restrict their activity after sustaining a fall. And sort of similarly to that, fear of falling in itself can increase your risk of falling. And a fear of falling can develop anywhere between 21 and 39% of people. And that fear, whether or not the fall has occurred, can also restrict activity. So kind of this domino snowball effect. If you have a fall, a lot of sequelae that come after that can affect physical and mental health. And even if you didn't have a fall, but you're afraid that you might, similar sequelae can occur.
So people are afraid of going out because they might fall. And what we want to do is we want to try to alert people and try to get them to not be afraid. And that takes in a couple of things. First of all, it takes in physical exercise, because if they do physical exercise, that will strengthen them. And what we want to do is we want to start out maybe by focusing on the risk factors that individuals have. Some of that happens when you go to see your doctor for your annual checkup, where they ask you to balance, correct, things like that. What would you do if an old guy like me came into your office? Don't laugh now. If an old guy like me came into your office, what would you run me through to see if I am physically able to not fall?
Yeah, there's a lot of important risk factors that you can even self-identify before you see a healthcare provider, but it is definitely recommended that you discuss this with a healthcare provider as well. But already feeling unsteady when standing or walking, that's a risk factor. If you have any sort of physical impairment to your mobility, like a knee that hurts every time you walk, that can increase your fall risk. An important one as we get older is medications. Totally not part of today's discussion, but polypharmacy is a big issue in older adults. And so it's important to work with your physician on, are there some medications that increase your risk of falls, make you feel dizzy, things like that. Vision, any changes to your vision, right? We use vision to assess the safety of our environment. So if that's compromised at all, can increase your fall risk. Footwear, that's a big one, I would say. Especially in the house, people like to wear slippers. Those ones that you just slip your foot in and out of. They have no back of the heel or back of the ankle support. Those can increase your fall risk. Or if you're just not wearing well-fitted shoes in general, inside or out of your house. Environmental hazards, making sure you're looking around your home. Do you have clear pathways for where you walk around? We always recommend getting rid of throw rugs. If you're determined to keep them, then making sure they're very attached to the floor so that they won't come up, things like that. And then the other things, again, to talk to your physician about are comorbidities, such as depression, cognitive impairment, neuropathy or sensation changes, any pain, higher low blood pressure, things like that can all affect your balance, your mobility, and increase your risk of falls.
Okay, so I have a question.
Sure.
Question is, what if I walk around without shoes or anything else? I just walk around barefoot. And has there ever been a comparison done with Americans walking around with whatever they're wearing, like their special slippers that they get as a gift, versus in Japan where they don't wear that? Has there been any comparison done?
It's a great question. I would be curious to know as well. I'm more familiar with studies done in the US with, Americans. But that's a really good question. There are benefits to walking barefoot. So when I mention footwear, it doesn't mean that you have to wear shoes. It just means that if you're wearing shoes, they really need to be well fitted so that they're not loose and hanging off of your foot every time your foot leaves the ground. Being barefoot, if you have intact sensation on your feet, can potentially improve balance because you're more in touch with the surface you're standing on. So again, if you have intact sensation on the bottom of your foot and you're barefoot, you're going to feel the hard floor, the soft floor, or if there's a pebble there, you're going to feel a lot more of the environment underneath your feet. But if you have any impaired sensation in your feet due to neuropathy or other things, being barefoot might not be advantageous because you won't feel things underneath your feet as well. And you can have a cut or a sore or step on something unsafe and not know it because your sensation is impaired. So the footwear conversation is, like everything else I'm going to mention today, pretty individualized to each person's needs and abilities.
Okay, now if one of your students wants to do a doctorate on what we just discussed, I want a credit.
Okay, I'll make sure to reach out to you to brainstorm some ideas.
Yeah, sure.
Okay. Here's the murmurs.
Well, let's talk about good news. That the evidence for exercise as a fall prevention strategy is very strong. You're a PT person, and it doesn't mean part-time, by the way, right? Just so everybody knows.
PT means physical therapist.
Exactly. So we're talking about PT as a physical therapist. So what does a physical therapist do, and how can you benefit? Because it's a major benefit to seniors.
Yeah, physical therapists, we're we definitely are known as movement specialists, right? So we help you move better, we help you move more, we help you move differently, right? Depending on your prior, current, and aspirational levels of function. We really focus on individualized care. We perform thorough evaluations of our patients to identify their specific impairments, right? Just because we know a large percentage of older adults have falls or at risk of falls, the reason for those falls, the cause of those falls is not the same between one individual to another. And so it's important to have an individualized assessment to figure out exactly what's going on that's causing this person to have more falls, whether it's a gait deficit, a balance deficit, weakness, dizziness, or just lack of confidence. So a PT at most places will work with you one-on-one to generally assess your abilities and design a individualized exercise program to address those impairments. I'm obviously a little biased being a physical therapist myself, but anytime anyone mentions themselves or a loved one that's having any issues with falls, my first recommendation is to always be a physical therapist. We are just very well trained in this area, and we work with our patients with some frequency, right? So you'll see your physician maybe once a year, once every 6 months. We tend to work with physical therapists once a week, every other week, sometimes more than once a week. It varies on the patient's needs and the facility, but we can really help follow through on a program and help someone get to a place where it's now routine, it's now a habit, and they can maintain it independently and keep that fall risk low.
Okay, so I've been through PT, and it's limited in the sense that they're usually working with you about some specific injury that you're getting over, and you're there for only a certain period of time before your insurance kicks out, and you can probably get more of it. It depends on how strong your policy is. But your goal is to really get people to be able to do exercises at home themselves also. Isn't that correct?
Yeah, I mean, my personal philosophy, and I think the care philosophy of a lot of physical therapists, is to foster independence and empower patients to take care of themselves, right? We're there at the beginning of your journey, the middle, the end, any part, but to help guide you in finding the right type of exercise that fits into your lifestyle, that fits into your current level of ability, that you enjoy doing, that you can do safely. We instruct you, we guide you. And then, like you said, if it gets to a point where PT can no longer continue for whatever reason, we give you resources. Here's a local senior center that offers group classes. Here's a personal trainer that I know that can continue to work with you. Or what's also really common is to say, come back and see me next year or in 6 months. And we can do a tune-up and see how you're doing. So yeah, it's the goal of physical therapy is to help you take better care of yourself, right? Give you the tools and the guidance, but in no way to be reliant or dependent on your physical therapist, but really as a guide and a resource.
Okay, let's focus a little bit on what I think you call the mechanisms, like the enhanced lower body strength, improving balance and posture, and neuromuscular coordination. Could you explain those things to me and everyone else out there who's saying, what the heck is she talking about? Or what am I talking about?
Yeah, let's take one piece at a time. Let's talk about improving your strength, right? So how is improving your muscle strength going to improve your balance? Well, another wonderful thing about getting older that we have to think about is sarcopenia, which is age-related loss of muscle mass. This actually happens at a pretty young age, but strengthening exercises throughout your life, and especially at age, is an important part of combating this. So maintaining your strength, especially lower limb strength, so like the leg muscles, is going to be an important part of reducing your fall risk. And in fact, there's a strong correlation between weak leg muscles and increased fall risk, as well as overall mobility. So increasing the strength in your muscles is going to help your body be able to more powerfully correct your balance when you trip over uneven sidewalk or tree roots, or when that car speeds by, you have to take a step high. If those muscles are strong, they're going to be able to respond more quickly and more powerfully so that it's an accurate correction. Having strong leg muscles is also going to make it much easier to get up out of a chair, go up and down stairs, which is something a lot of us have to do every day. And it's just going to improve your stability when you're standing and walking, help you walk faster, and it's going to reduce the need for walking needs such as a cane or a walker. So overall, improving your leg strength kind of carries over into their internal systems.
I walk about, as you have a dog. I don't know, how big is your dog?
70 pounds. He's a big dog.
70 pounds. He's bigger than about twice the size of my dog. But because of that dog, I walk every day. It makes me walk, even though I like walking. I walk at least 2 miles every day. It doesn't sound like a lot, but for somebody who's consistent, it's not a bad thing. But is walking the only thing you need to do?
No. Walking is a great form of exercise for general aerobic exercise, cardiovascular health, mental health, and overall functional ability. But walking is not going to strengthen your muscles. It's not going to combat sarcopenia. You need focused, isolated strengthening exercises to build strength. It's just the only way you're going to do it. And the American College of Sports Medicine has very clear guidelines in terms of what amount of exercise they recommend for adults, like younger adults and older adults. And for older adults, it's a minimum of 2 sessions per week. So 2 times a week, you are doing focused strengthening exercises. Weights, resistance bands, could even be body weight, right? You can do squats without any weight. That's a strengthening exercise. So you do need specific muscle strengthening exercises to improve your strength and to get the benefits of strengthening for reduced fall risk. We don't want to minimize the benefits of walking, but it's not going to address that specifically.
I've spoken to a number of people about Tai Chi, and Tai Chi is an Asian original exercise form, and you usually see pictures of 100 people or 50 people outside in a field doing these exercises, very slow motion. It's kind of like, I guess, karate. Is that beneficial? Has it been proven that that's beneficial for people to do? Because it does do a lot of balancing.
Definitely. Yeah, actually, there's quite some research to support the benefits of Tai Chi specifically. I know of one study that compared Tai Chi to like standard physical therapy for balance training, and both were effective. It wasn't necessarily one was better than the other, but both were effective in improving participants' balance. So Tai Chi, I think because of that, has become more readily available and popular in a lot of senior centers because we know that it can help improve balance. I'm not too familiar with it myself, but it is asking you to pay more attention to your body. So I have a feeling that it improves this proprioception, awareness, body awareness, and that just improves your mobility, through the world around you.
Yeah, well, I have a personal experience with that because my wife and I are both going to a senior center, and once a week they have a Tai Chi for beginners. We go there, we take the course, we learn approximately 8 different moves, and then we're supposed to practice it a few times a week, which of course we don't do, but we should be doing it. It's just like I'm just a regular patient.
You know the problems we face. Yes.
Yes, exactly. You're going to tell me this is what I need to do. And I'm going to say, yes, doctor, thank you very much. I'm going to try to do it. And then I walk out and I say, I'm sorry. Okay. So let's go back to actionable steps that you can take to prevent yourself from falling, because it's really up to you to take care of yourself, because you're the one that's going to have to stop your fall. Correct?
Yeah, or even loved ones too. So I feel like this information is beneficial for those who identify themselves as someone who might fall, and those who identify themselves as a caregiver, a family member, a loved one of someone who might fall. The first step to take is to be honest with yourself or your family members or whomever and say, are you afraid of falling? Do you feel unsteady when you're walking? If the answer is yes to any of those questions, you should do something about it. And if you've had a fall already, then definitely. In the first place to start, it's always your primary care provider. It's a good place to start mentioning to your physician, hey, I'm worried about falling and my balance. They might want to do some tests, right? For your vision, your hearing, make sure the sensation in your feet is intact, review your medication as we discussed. And then they probably would recommend that you work with a physical therapist. And if they don't, you can ask, right? You can say, hey, I heard that working with a physical therapist might be beneficial. And they can just rate you on a referral. Those next steps vary depending on your insurance and all of that, but you might be in an HMO and have to do everything else, so you can go to a place that they're choosing. And then the other things that you yourself can do is assess your home safety. You have grab bars in the shower. You have railings on indoors and outdoor steps. Are your walkways clear, both inside and outside? Do you have small animals that sneak up on you and you don't always know they're there? Maybe you need to put a bell on their collar so that you can hear them and not be surprised and trip over them. We talked about footwear too. Some people like to wear slippers in the house. That's fine, but maybe find ones that are more like a moccasin or something that surrounds your whole foot and securely attaches to your foot. And then when you're leaving the home, something abrasive, Velcro, again, anything securely fastens to your foot. Nothing can open back or slip on shoes. Those are all going to increase your risk. And then if you're already an active person, just knowing that exercise is going to be super beneficial for you in reducing your fall risk, keep up with your activity and find ways to be active as your body changes, your lifestyle changes. Find something that you enjoy and that's accessible to you that will help you stay active. And if you don't know where to start, or it's been a while since you've exercised, or you've never been an exerciser in your life, it's never too late to start, regardless of where you're at. And a PT or a physical therapist would be a great fit to help you figure out what you want to do. I think a lot of people put exercise on this pedestal and are really afraid of it because they think it requires equipment and a gym membership, and I have to be able to leave my house and do it in front of other people, and I need to have already been strong. And there's a type of exercise for everyone in your home, outside of the home, in a group setting, and just yourself setting. And a PT can help find that right exercise to put you where you're at. If walking is even a challenge for you, lots of exercises you can do seated, standing with support, even in a laying down position. So exercise is for everyone, and you have to find the right height.
Okay. All right. Very good. Is there anything else you would like to add to our conversation today that we've missed or that I screwed up?
I think we hit a lot of the main points. I think the only thing I want to say is, if I didn't make it already clear, that the push for being active and exercising to reduce your fall risk is not just my opinion or my profession's opinion, but it's strongly backed by years and years of research. Before I met with you, Glenn, I did a lot of review of the literature that we teach in our program, and some systematic reviews as recently as 2022 or 2024 just reinforce that exercise, even as a single intervention with nothing else, can reduce your risk of falls. It can reduce the rate of falls, the amount of injury associated with falls. And it's, it can be free. There's lots of versions of exercise that are free and accessible. So it's kind of one of the best things you can do without going down a whole other rabbit hole of all the things that exercise can do for you. It can definitely improve your balance, reduce your fall risk. It can make you just feel more confident in your mobility, which in itself will reduce your fall risk. So yeah, I just wanted to emphasize that the literature is out there strongly in support of exercise helping to reduce fall risk. So don't feel like there's nothing that you can do or nothing really works, because exercise is one of the best and most accessible things.
Well, I think that what we're saying back and forth is really just about the same thing, that there's always a risk of falling, that there are ways to help yourself not fall, primarily some form of exercise. One of the things I wanted to mention that I had done in another podcast was very interesting. I had spoken, it was to one of the I might have been one of the doctors from University of California in San Francisco, but they said that when people pass and they're in the hospital and something happened, the doctor who's looking at them and is issuing the death certificate is looking at what happened recently. But what they found in studies is that if somebody had a fall even 3 years prior to that, and then they had injuries because of that, they broke a hip or they twisted 2 ankles or they now walk with a limp or whatever it is, or they had a concussion, that is the initial cause of that person's death. But it's never reported because the physician is in the emergency room and and somebody passes. They don't look at the history. So I'm sorry to everyone that is listening that I'm harping on this, that not falling is really important. So I've spent a lot of time with professionals to try to get that across, okay? And I want to thank you, doctor, for taking the time. I'll call you doctor right now, and then I'll call you Joe afterwards, okay? And I thank you again for taking your valuable time and explaining what PT stands for, okay? In addition, and I just have one more quote for the people, and then we can just say our goodbyes for this session. Exercise is the only thing that has been proven to prevent falls. And this is by a Dr. Sonia Rosen, who's chief of geriatric medicine. I don't know where because the quote didn't say it. So I'm just going to quote you and say, Dr. Joe Bergh is the one that told us that. And with that, we're going to end today's podcast. Hope to see you next week, everyone. All right. Goodbye, everybody. We'll see you next week. You're welcome. And that concludes this episode of We Are Old, Get Over It. Thanks for joining me. I hope you found our conversation both insightful and entertaining. Remember, age is a journey, not a destination. So embrace the wrinkles, the forgetfulness, and the occasional tech frustrations with a good dose of get over it attitude. Until next time, keep laughing, keep learning, and keep getting over it. Ken out.
This podcast features a variety of perspectives. The views and opinions expressed by our guests are solely their own and do not constitute an endorsement by this program. Unless otherwise stated, this podcast does not endorse the products and services of our guests, but shares them for informational purposes only.